Hi, this is Ray Anthony, podiatrist and consultant to Spenco Medical Corporation. In this podcast, I'll introduce you to the Quickthotics component insole system from Spenco. But before I show you the product, let me first say, there is reasonable research evidence to suggest that non-prescription, preformed insoles may be as effective as casted, custom-made orthotic devices in the treatment of common musculoskeletal pathologies of the foot and the lower limb. In fact, in one study by Pfeffer and colleagues in 1999, prefabricated insoles provided more symptom relief than custom orthotic devices in the initial treatment of proximal plantar fasciitis. Now, you'll find a list of these studies on the Quickthotics pages of the Spenco website at www.spenco.com. The Quickthotics component insole system blurs the distinction between custom-made and preformed for orthotic devices. Now, here's the beauty. With Quickthotics, you can fabricate and dispense high-quality, durable prescription orthotic insoles in the office in less than 5 minutes. That's literally in less than 5 minutes, with myriad prescription options: rear foot and forefoot posts, heel lifts, heel cushions, calcaneal dells, the choice of 3 arch supports with different stiffnesses, first ray and first metatarsal head cutouts, metatarsal domes, forefoot cushioning, and the insoles have a technical anti-shear top cloth infused with ultra-fresh and antimicrobial agent. Now, there's no need for a heat gun or a grinder. The only equipment you'll need is a pair of scissors to trim the forefoot extension to fit the shoe. All the self-adhesive prescription components are die-cut perfectly to dovetail with the total support insole. Now, with Quickthotics insoles, you have total control over your prescriptions. You know exactly what you're prescribing, not what the laboratory says you're prescribing. Adjustments at follow-up appointments take seconds in the office, and your patients get immediate and cost-effective foot orthotic therapy, and you get lower laboratory bills. Best of all, Quickthotics is from Spenco, and you know that's a name you can trust for top-quality foot healthcare products. Let's take a look what's inside this very attractive carton. We remove the dust sheet. We have a pair of total support insoles. Total support technology means a deep heel cup, a medial longitudinal arch support, some lateral arch support, and a metatarsal dome. The Quickthotics insoles are EVA and full length. On the inferior aspect of the insole, we have 2 yellow EVA plugs. The first plug is a calcaneal dell plug. Simply remove this plug to create a calcaneal dell to offload the inferior aspect of the calcaneus for conditions like plantar calcaneal bursitis. There's also a first metatarsal head, first ray cutout plug. Simply remove this plug to create a first metatarsal head cutout, first ray cutout, kinetic wedge for functional hallux limitus or for plantar flexed first ray, for example. The area for the forefoot valgus post is recessed so that this component is accurately positioned. And the area for the medial longitudinal arch support is also recessed. There are trim lines so that the insole can be properly fitted to the patient's shoe. Here are the die-cut components, all self-adhesive. We have a pair of replacement calcaneal dell plugs. If you've removed the calcaneal dell plugs and you want to replace them, accommodation is made for that. There are 2 replacement first metatarsal head and first ray plugs. If you've removed them and you want to replace them, accommodation is made for that. There's 2 high-density, 3-degree forefoot valgus posts, self-adhesive. And for the rear foot, there are 2 separate components. There's a pair of 3-degree rear foot varus or rear foot valgus posts. And there's also 2 5mm high-density EVA heel lifts. Last but not least, we have the nylon arch supports. that dovetail perfectly with the total support insole in the medial longitudinal arch. Now there's 3 rigidities of the arch support: flexible, semi-flexible and rigid, so that the midfoot area of the Quickthotics insoles can be stiffened to prescription. Now also included in the carton are patient instructions, what you should know about wearing Quickthotics insoles, and a 30-page booklet in 3 languages to describe common treatment protocols for the most common pathologies of the foot and lower limb. Now, we all have our own prescription guidelines, but this provides a really good start for people first getting used to the Quickthotics insoles. So it's really beyond the remit of this short podcast to show you the setup of Quickthotics insoles for the common musculoskeletal pathologies of the lower limb. So what I want to do is just show you how easy it is to apply the components to the Quickthotics insoles. Here we have a right insole with the appropriate die cut and self-adhesive components. Here we have a forefoot valgus wedge, we have a rear foot varus wedge, we have a heel lift, we have the 3 nylon arch supports ranging from flexible to through semi-flexible to rigid, and of course we have the 2 EVA plugs for the first metatarsal head first ray cutout and the calcaneal dale cutout. Now what I'm going to do here is I'm going to apply a heel lift for, let's say, an Achilles tendonitis. I'm going to apply a forefoot valgus post, which has been found to be useful for plantar fasciitis. And also for plantar fasciitis, what I'm going to do is I'm going to stiffen up the medial longitudinal arch. So here we go. Here we have the heel lift component that I want to add. I'm going to peel off the backing and I'm going to apply the heel lift. Job done. I'm going to take the forefoot valgus wedge. I'm going to peel off the backing and I'm going to apply the forefoot valgus wedge into the recessed area to make sure it goes in exactly the right position. I'm going to select now a very flexible, or the most flexible arch support. I'm going to take the die cut piece. I'm going to remove the protective backing to expose the adhesive. And I'm going to insert the arch support into the recessed medial longitudinal arch support area. And that's done. Let's say now I wanted to add a first metatarsal head first ray cutout. Let's say for a plantar flex first ray, I just peel this out. Now what we have here is an orthotic insole with a metatarsal dome, a deep heel cup, some medial longitudinal arch support. This is stiffened. We have some lateral arch support. We have some forefoot cushioning. We have a forefoot valgus post. We have a heel lift. And we have a first metatarsal head first ray cutout. That's the Quickthotics insole finished for this prescription, and it's taken just a couple of minutes. It doesn't matter which prescription paradigm you use to create your orthotic devices. It doesn't matter whether you believe that orthotic devices function primarily in a kinematic way, that they control motion, that they change foot posture, that they support the arch, that they control, let's say, excessive calcaneal eversion in a foot exposed to high magnitudes of pronation forces, or whether you believe that orthotic insoles function kinetically by changing the magnitude and the direction of ground reaction forces against the sole of the foot, the external moments, which in turn changes the internal moments acting around the joints of the lower limb, which in turn modulates the tensile and compression forces within the joints and within the periarticular structures. It doesn't matter which paradigm you adhere to, the Quickthotics component insole system can be used to establish prescriptions that will match your particular orthotic prescription paradigm. Well, thank you for watching this podcast. I hope that you found it informative. I hope that you found it helpful for when you introduce Quickthotics into your practice. Give Quickthotics a try. I believe they'll be good for your patients. I believe that they'll be good for your practice. Should you have any questions about Quickthotics or any other Spenco products, please visit the website at www.spenco.com. While you're there, make sure to visit the area where you can download our regular newsletters, which contain articles on biomechanics and other areas of orthotic interest. So again, thank you for watching, and this is Ray Anthony bidding you a fond farewell, signing off, and looking forward to meeting you again in the near future.